This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. I think that's one of the things that, I have like feared about ER is like those types of like angry patients. Like how do your colleagues kind of like work through those situations, or what's been effective for you?
Well, I think first of all is just kind of hearing them, right?
Yeah.
What do you got to say? And then you try talking to them, and of course that never works because they're already angry. And you go through the whole training that they give you at the hospital on how to manage and do customer service, and sometimes that
Mm,
just doesn't work because and sometimes you just have to say, hey, look, stop. I'm not here for you to be swearing at me. I'm not here for you to be, you can
yeah.
think about it, and then you just kind of turn around and you walk out of the room. You remove yourself from the situation. I
Yeah.
mean, sometimes it's not that easy to turn around and walk out, right? Because they've pushed your buttons or because that's what they're good at, right? So
Yeah.
a lot of times you just gotta say, look, you know what? I'll talk to you in a little bit, right? And you come back a little bit later, or maybe they're angry because they're not getting that medication they wanted for pain, right?
Mm-hmm.
Instead they're getting the Tylenol or the excuse me, the non-branded pain relievers. Um, but there's always that one that starts with the D,
Yeah,
you're right.
right.
So
Delata.
something, yeah. But that always takes my pain away really fast. Yeah,
Diphenhydramine.
yeah,
That's what
that
it,
one, right?
yes.
Yeah, exactly. So, but once they find out they're getting that medication they want, everything changes, right? Oh,
Hmm.
I'm so sorry, I swore at you. I'm so sorry at this, and it's like, yeah, we probably should have thought of that before we started slinging words, right? So,
Yeah. I know. I mean, I think honestly that's one of the patient populations that I'm not good at is ones that it's drug seekers. It's like the ones that know how to manipulate people. And I think that's such a hard population to navigate for a lot of nurses because you're here to care for others. You're here
right.
to be in that presence, and a lot of times you're there to serve. Like I mean, that's kind of a mentality of
Yeah.
nursing
Yeah.
sometimes. I had that mentality for a long time, and I've no longer have that mentality. But it was hard because you get taken advantage of,
You
and
do?
so that's always been a really hard patient population for me, and I'm always
Yeah.
interested in how people navigate those patients.
Once you've seen a few of them, you kind of know who they are, right? I mean,
Yeah.
and you know what their game is. And so what I'll do with that is I'll communicate it to the doctor. And there's of course other ways that you can tell physiologically what's going on with them. There's always something in the room that kind of tells us what's going on, right? So uh, I think that we're not the police, right? So, it's
Hmm.
ultimately not our decision as nurses whether this patient gets this medication or not, right? So, and it's ultimately
Yeah.
the doctor's responsibility. And at some point, these patients get figured out, whether it's that day that they're with you, or whether it's the next week they come back, or the 30th time that they come back. Somebody always figures it out, right?
Yeah.
Yeah.
Yeah. Yeah, that's
And
very true.
so, what do? There's an order that's written for your patient, and obviously, if there's some other confounding thing going on or something that's kind of detrimental, or what's the word I'm looking for? Um, Gosh, I'm at a loss for words. First time I've ever been at a loss of
Like
words.
an appropriate situation where they would be getting pain medicine,
Yeah,
maybe. Yeah.
absolutely. Yeah. Or there's something that, hey, we can't give it to you because you've got another medication on board, or
Yeah.
that's a little
Yeah.
different, right? But it's
Yeah.
really not our decisions, and it's not up to us to be judgmental about, what not about what their motivators are, right? And now I
Yeah.
say that, but I'm human just like everybody else, right?
Hmm.
So, um,
Yeah, I think that's an important thing to note is like, you can only do so much. You can only say what's ordered. You only have the ability to carry out the orders, and
yeah,
you can communicate to the team what the concerns are and your assessment findings obviously, and come up
yeah,
with a good treatment plan. And sometimes that's not what the patient wants, but that's that's the best that you can do.
Yeah.
Sometimes.
And I
So
think, so long as they don't get upset with you and start swinging at you or whatever, there's always ways to manage that, right? I mean, yeah. And working at a county hospital is just a completely different animal, and just the things that you see, and how the acuity of mental health patients that you see.
mm,
Yeah, yeah. You know, we're punching bags sometimes, right? So,
yeah. Yeah, I'm sure that probably the highest amount of, violence a lot of times is psych units and ER.
yeah,
I think, just because of the patient populations that you
yeah,
see. I mean, you come in, any walk of life comes in to
yeah,
both, places.
yeah. I'll share a little bit about with you. I've been headbutted, been kicked in the chest, punched in the chest. I've had a patient kind of take me down, or we both gone down. It's just kind of crazy sometimes, the things that you don't see, in day to day life, right?
Yeah,
So
right.
yeah,